Welcome to AI for Good, the leading action-oriented global and inclusive United Nations platform on AI. Organized by ITU in partnership with 40 UN sister organizations and co-convened with Switzerland. The goal of AI for Good is to identify practical applications of AI to advance the United Nations Sustainable Development Goals and scale those solutions for global impact. In today's session, we're counting on you to use the live video wall feature to ask questions and post comments to help create an engaging discussion. We encourage you to stay until the end, as we will hold a 30-minute networking session in the neural network. Here you can meet, ask questions to our distinguished speakers, connect, and chat with the AI for Good community. It is now time to kick off the session and welcome our first speaker. The floor is yours.
Hello, and welcome all to today's session on GeoAI and Health. My name is Andrea Manara from the ITU, the International Telecommunication Union. And it is an honor for me to introduce a new episode in the GeoAI Discovery Series. The series is curated by three outstanding geospatial professionals, Nadine Alameh, Maria Brovelli, and Barbara Ryan. We launched this series on February 1st. If you missed the previous episodes, don't worry. You can watch the recordings on those events on YouTube or on the neural network to which you are connected right now. I also wish to inform you that tomorrow we will hold the launch event for the GeoAI Challenge. The challenge is a competition where anyone with the knowledge of machine learning can participate to solve problem statements in the geospatial domain and win prizes. We are pasting on the neural network the link to the challenge. Without further ado, let me now introduce Nadine Alameh. Nadine is the Chief Executive Officer of the Open Geospatial Consortium, or GC. She's also board member of the UN Geospatial Global Information Management Private Sector Network, and she was appointed in March 2022 by the US Department of the Interior to serve on the National Geospatial Advisory Committee, where she represents the interest of the nonprofit sector. She will introduce this session and introduce you to the outstanding moderator and speakers of today's session. Nadine, the floor is yours.
Thank you so much, Andrea. It's great to be here. On behalf of the OGC, very appreciative of this leadership of the ITU in launching this GeoAI for Good initiative, and this community collaboration educational platform that we're contributing to today. So I'm very happy of this partnership between ITU, WGIC, and the UN GGIM, the academic network. So Maria and Barb as well, many thanks for getting us this far. And as Andrea mentioned, we have had an amazing series of sessions so far on all sorts of topics. And today's topic is on health, so GeoAI for Health. And I'm very, very happy actually to be here, very happy, very proud, very honored, honestly, to be here to introduce the convener really of this session and the moderator, Mr. Ajay Gupta, who's put the session together in the background and who's going to lead us through, I guarantee you, going to be some insightful, I think, session about GeoAI and health. To quickly introduce Ajay, I've known Ajay for a few years right now because he is the chair of the OGC Health Domain Working Group. And he does it because of his passion for using geospatial for health. So he's really bridging geospatial and health. And the best example of him bridging those two worlds is by him founding his company, his business called HSR.health, who he founded, and he leads with, again, such passion because the topic is very dear to his heart. He's really trying to get his team and trying to get the rest of the community to transform healthcare using the power of technology and using the power of geospatial. So under Ajay's leadership, actually, HSR.health really pivoted in the last couple of years to support COVID response in the US and worldwide, and has taken essentially this global pandemic as an opportunity to improve what we can do globally as a community, as businesses, and as governments to truly impact and advance the health sector for broader impact. So one of the amazing pieces that I find about Ajay is that he thinks big. So he's developing with his team this digital disease surveillance and intervention solution so that we can identify and mitigate future pandemics. And it's this energy, again, that I enjoy, when connecting with Ajay. His leadership of the OGC, Health Domain Working Group is coming from this dedication, I think, to making things better and to using technology, and in this case, the geospatial technology, which we're going to talk more about during the session, to advance something that affects us all, because health affects us all. So with that, may I invite Ajay to the stage so that he can lead us through the session.
Thank you, Nadine. Thank you for that wonderful introduction. And thank you, Andrea, and the ITU and all of the organizations that collaborate to make this series of events possible. We certainly know that artificial intelligence is here, and whatever the concerns about AI are going forward, it is going to be a larger and larger portion of our daily lives in the future. So learning how to use these technologies effectively and safely, ethically, is certainly important, especially in our case today, when we marry artificial intelligence technologies and capabilities with geospatial technologies, and how these two working together in concert can really advance our lives in a specific way. And we're talking specifically in the healthcare domain, which is, of course, as we've learned during the pandemic, that's the domain for which we will stop everything else if there is a threat to healthcare. So let me briefly set the stage for the panel today. And we'll share my screen. Thank you. Quickly, we will have a panel. I will introduce all of the panelists individually, and then all of us will join for questions at the end. Briefly about us. HSR.health is a geospatial health risk analytics firm, as Nadine mentioned. We support the global public health and emergency response communities by leveraging geospatial technology and advanced data science models, including AI and agent-based models, as well as public health models and social determinants of health, to essentially do two things. One, track the spread of disease, whether infectious, as we've seen the last 2 years, chronic or social disease as well, to identify the medical resources needed to treat the infected and, if possible, stop the spread of disease itself. In health, we've seen that GeoAI can do a number of things. There are really broad roles for what GeoAI can accomplish in public health. And Nadine mentioned a few areas that have captured the attention of communities in our areas of development. One certainly is to curate and make available sets of data that are typically not included in healthcare, especially where that data includes a location component. For instance, the location of healthcare facilities where it is essentially just as important in many cases to know where the facilities are as to know the services offered and the capacity to offer services. Geospatial tech can also lead the charge in capturing data from novel sources, including digital twins, which are going to be more and more helpful in the training of surgeons, for instance, in the future. The Internet of Things, Internet of Medical Things, and smart cities and wearables will form new sources of data, along with, and this is something that we're very excited about, Earth observation satellite imagery, where it is going to be possible potentially in the future to learn not just about climate change and natural disasters, but other factors that influence health on a daily life from satellite imagery and satellite plus drone associated technologies. Geospatial visualizations are also effective means of communicating with decision makers, whether elected officials, public health authorities, and even the general public, about real life concerns. But curating and making data available to all relevant parties in itself does not solve public health challenges. Improving health outcomes requires specific things to happen. Knowing which things comes down to answering a set of related questions. Who specifically in which populations and communities are at greater risk of a health issue? What are the underlying factors that contribute to that risk? How can those populations be best served, treated, to overcome those risks and essentially to address the health challenge? And where should those interventions be launched to improve health conditions? These questions can be addressed by GeoAI. The integration of AI solutions along with geospatial technologies, public health models can answer these questions, providing specific guidance to decision makers on what to do on specific illnesses in specific areas. The guidance can lead to actionable approaches to patient care, such as launching social interventional methods to remove barriers to health, as well as applying medical devices. And we can see that by understanding the factors as to specifically where those factors impact patients' lives, can provide guidance on the social measures to intervene. It can even supply or provide guidance on where medical devices and supplies needed specifically to provide patient care. And when we get down to the level of making or helping make the actual decision on the ground, then we know that we have improved public health. And now on to our panel. The first speaker is Dr. Steve Mcfeely, the Director of Data and Analytics at the World Health Organization. He's also an adjunct professor at the Center for Policy Studies at the University of College Cork in Ireland and the Director of the IASE International Statistical Literacy Program. He is co-chair of the Committee of the Chief Statisticians of the UN Systems, and chairs the Advisory Board of Statistical Journal for the IAOS, and is a member of the Statistical Advisory Panel to the UNDP Human Development Index. Steve is an elected member of the International Statistics Institute. He was a co-lead on the data strategy of the Secretary General for Action by Everyone Everywhere, 2020 to 2022, and the lead author of the 2020 System-Wide Roadmap for Innovating UN Data and Statistics. Before joining the WHO, Steve was the head of statistics and information at the UNCTAD. Prior to joining the UN, he was the Deputy Director General at the Statistics Office in Ireland and Program Director of the Joint CSO, Institute of Public Administration, Professional Diploma of Official Statistics and Policy Evaluation. If Steve wasn't a statistician, he would likely be a Lego engineer. Please welcome Dr. Steve Mcfeely.
Thanks, AJ. It's my great pleasure to be here. And hello to everybody. So let me share my screen. What I'm going to do today is talk a little bit about what WHO is doing with regards to GIS and how we're integrating it with our data. So what I'd like to do is start with, before I joined the WHO, so you'll understand why GIS is so important to me. Myself and a colleague published a paper back in 2014, and that paper was built on the Nordic model which was really around the use of unique identifiers and the importance of linking different types of data. So in other words, we were making the argument that everything happens in time space. So if you want to link business activity or economic activity to people data or social interactions, one of the easiest ways to make that bridge or that link is through location or geospatial. And hence you see the importance. Now, when I joined the UN, one of the things that I very quickly realized in developing countries, that often wasn't possible. And one of the reasons it wasn't possible, apart from technical reasons, was in a lot of cases, the governance around data were quite weak. And what I mean by governance is a combination of a legal framework, so that this would allow legal safe access to data, both primary and secondary, but also the institutional frameworks that would allow different agencies to work together to exchange data in a way that's legally safe and secure. So myself and a colleague wrote a subsequent paper which really built on the first paper. And so in my thinking now, what you see is the importance of geospatial, but also the importance of data governance. And I think Ajay mentioned that right at the start of his remarks. So that brings me to the WHO. So I joined the WHO at the end of last July. And one of the first things we did, we had a health data governance summit over 2 stages last year. And one of the outcomes of that summit, probably the most important outcome, was we agreed that WHO data and data products should be global public goods. So this is the other part of the other element, which we're saying that everything we produce should be open, it should be accessible and usable to everybody, and at the same time. So in other words, no communities should be privileged. Then it was my great privilege in June, just a while back, to launch finally our WHO GIS Center for Health. Now, in many respects, WHO was doing GIS for quite a long time, so it wasn't new per se. But what new was the formulation of the center and within the data and analytics division. So here, what we're really trying to do is bridge the link between GIS and between statistics and data. So before, the two have coexisted, but maybe haven't interacted in a kind of an integrated fashion. Now we're trying to put the two together to make sure that every time we produce a new statistical data set, a new statistical product, that we integrate GIS and the geolocation information into those data sets. So really, this is our kind of mission statement. So by connecting maps, apps, data, and people, the center is dedicated to supporting countries and WHO to make public health decisions faster. So how are we going to do that? Well, we have basically a set of work streams. And what we're trying to do is link 3 goals. So the overarching aims, as I said, is to enable WHO both at HQ, at regional level, at country level, to operational and scale geospatial data. We want to foster meaningful relationships that are fit for purpose. So in other words, that we're getting something out of it, but so are our partners. So it's a win-win for both. And to maintain and consolidate a repository of geospatial information, tools, classifications, so that they can be effectively deployed across all of WHO. And to do that, we've developed 5 different work streams, and you can see them there on the screen. So one is really operationalizing plans around GIS, establishing regional networks to support and scale GIS. And we're using the what's happening in Afro as an example. Complete some geospatial baseline analyses. Then offer capacity development, both in WHO and in countries and regions. And then incorporate innovative techniques. And I guess this is really where the AI component comes in, to take in the latest technologies, latest techniques, latest algorithms to help us develop what we're doing. This is the GIS team. It looks enormous, but in actual fact, it's largely consultant based. So the real team is quite small. But I guess the advantage of this team, though, is it's very geographically dispersed. A lot of range of different cultures, different backgrounds, and different skill sets. So a very, very powerful team. Then the GIS Center for Health strategy is really built to complement the geospatial strategy for the United Nations. So in other words, we've taken the UN strategy and tailor-made or tweaked it for WHO purposes. And that strategy really focuses around 3 areas, as you can see on the screen there. So tools and technologies, exchange for partnership, and then technical support and capacity development. So if we look at tools and technologies, the areas that we're really trying to develop is build a gateway for geospatial data sets. So building a one-stop shop, provide geo-enabled workspaces. So helping everybody to use the technologies and tools, provide a baseline and infrastructure, which we call the GeoMart, and then to try and capitalize on the visualization so that we can make dissemination interesting and exciting, which will hopefully make it usable, but make it more attractive to people to use as well. In the technical expertise and partnership, this is really, as the name would suggest, it's about partnerships. We can't do what we need to do on our own. So we work very closely with partners such as UNFPA, UNICEF, Gavi, to get the jobs done. So a very simple example would be the work that we're leading with UNICEF on COVAX, funded by several donors. And this is really providing geospatial technology to try and facilitate equitable vaccine distribution using digital microplanning. And again, once we get this up and running, we can then rescale and repurpose this technology time and time again. Then perhaps one of the most important areas is technical support and capacity development, because we see it in both within WHO, but also across the regions and the countries. A lot of people want to use GIS, but they don't have the capacity to do it, and they need quite a bit of help. So developing programs with countries and with partners to give them the training and the tools that they need so that they can start capitalizing on these technologies. And here, this just gives you a summary of some of the technology and capacity development that we're doing. So we're building story maps. We've been running a set of knowledge series throughout the last couple of months. We've also been doing learning series in AGOL. We also hold open office hours, so that there's we've also done like an open house. So there's certain days where basically we dedicate our time to the country. So anybody can ring up with any queries and we'll do our best to help them work through it. But we try and work through the problems with them so that they come away not just with the problem solved, but with increased capacity. So this kind of gives you an overall view of some of the types of things that we're doing. I'm going to mention 2 of them in a moment, but you can see, so there's the COVAX group, we launched it as the Global Health Facility Database, but in fact, we've just renamed it recently as the Geolocated Health Globally Facility. That was because the word global seemed to be upsetting some people. We're helping the COVID-19 Tools Accelerator, adding a GIS component to that. I'll be talking about the snakebite portal in a moment. And then we're doing a lot of service training, and then also helping groups like immunization with adverse effects training and assisting them on the ground. So quite a bit of work been undertaken. So let me give you 2 quick examples. So back in March, last September, we launched the Snakebite Information and Data Platform. And this really combines a number of issues. One, it's the neglected tropical diseases. There's thousands of people die every year of snake bite, but it doesn't get high profile. So what we're trying to do is link the statistics with the health facility information. So what you get on the platform is you can see where the health facilities are and which health facilities have antivenoms and which antivenoms they have. We're also tracking the habitat of snakes, and this is important in the context not only of antivenom, but also in the context of climate change. Because as climate change is affecting locations, we see that animals and snakes as well are moving and their habitat is shifting. And what it means then is if the health facilities aren't up to date, they may not realize that certain venomous snakes have moved into their territory and they don't have the right antivenom. This platform also has a kind of a crowdsourcing or a citizen science component where people, if they see snakes, they can load up pictures with the location of where the snakes were seen. These are validated by our snake experts. We have a biologist working on this full time. And then we can see what type of snake it was and whether that snake is outside its typical habitat. And surprisingly, to me at least, there are hundreds and hundreds of pictures being loaded up onto this portal. I say surprising because I think if I saw a snake, the last thing I would do is take a picture. I would disappear as fast as I could. So this is a really, really practical example of how GIS, AI, and kind of citizen science are all merging together to provide really, really interesting and useful information. Then, as I mentioned, we launched this as the Global Health Facilities Database. We've just recently rebranded it the Geolocated Health Facilities Database. And what we want to do here is create a portal where countries can geotag and make all of that information available of every health facility in the country. From a statistical point of view, this will be super, super useful for us because in a lot of cases, we have a lot of health facility assessment surveys. It's very difficult to draw a proper randomized sample because we don't have a good register. And then equally, it's very hard to extrapolate up back to the population so we can draw inferential statistics. But then also, by building a platform that has a number of unique identifiers, then we can then link other data to those facility databases. And in particular, in the context of health information services, this will allow us then to really build really, really rich data sets and then build a lot of models from those. So then just to conclude, for WHO, we see data, GIS, and AI as all basically interconnected and interdependent. That they're all different components of a broader ecosystem, and they're all equally as important. As I mentioned, data governance is critical to this, and data governance should encompass GIS and artificial intelligence. So it should encompass all the data, but all the products and derivatives as well. And this is very important, as Ajay mentioned at the start, so that we maintain trust in the products and we don't inadvertently accelerate inequalities. As I mentioned, the driving motivation at the WHO is to produce global public goods. And when I talk about public goods, not just in the economic sense of the word, but in the broader sense where we're actually trying to do something of value that publics can use. So I'm not talking in the narrow sense of being non-exclusive or non-rival or non-excludable, but just more in the sense that we're adding value to the public and the public can use them. Also, just to note, at the UN, in the broader UN, there's a lot of work underway now to develop a global digital compact. And as you may know, there's a global consultation is open at the moment. There's also work underway, a tentative work on developing a global data compact. And it's just to note that it's very important that the work being done with UNESCO and others on AI, and then work being done with the groups here today on GIS, that all of the kind of governance work is consistent so that we get the same message in the Global Digital Compact and in the Global Data Compact and in the previous work being done on AI standards. So with that, I will finish. So thank you very, very much for your attention.
Thank you, Dr. Mcfeely. We'll turn now to our next speaker, and we will save questions to the end. Jay Etherton is our next speaker. He's a trained epidemiologist and runs the data science team at HSR.health. He has conducted geospatial analyses of the economic effects of COVID-19 transmission at the industry level, developed models to understand the impact on human health from climate change, as well as develop the Zoonotic Spillover risk model. Jay has led efforts supported by the Gates Foundation on social factors influencing disease spread. He has also studied the impact on educational attainment on food insecurity. Jay holds a Master's of Public Health in Epidemiology and Biostatistics from the University of Maryland School of Public Health. Outside of work, Jay competes in the United States powerlifting competitions and is a past Maryland State Junior Bench Press record holder. Welcome, Jay Etherton.
Thank you for that introduction, Ajay. I'll share my screen now. Okay, so my name is Jay Etherton. I'm a data scientist and epidemiologist at HSR.health, and I'm excited to present some of the work that we're doing to improve our resilience to new pathogens. Today I'll be discussing a geospatial concept model we have developed to understand and mitigate the risk to human health from climate change and zoonotic spillover events. The model uses a diverse set of data sources, including climate data, environmental data, and social determinants of health. So just as an overview, I'm going to briefly present some of our past and current work at HSR, and then I'll give an overview of the phenomenon of zoonotic spillover and how it's affected by climate change. I'm then going to talk about the model we are developing and to map out the risk of zoonotic spillover. HSR.health is a geospatial health technology company with a focus on using geospatial technology, machine learning, and artificial intelligence techniques to understand public health problems and develop new solutions. We have developed risk indices for public health issues like the opioid epidemic, as well as supported health systems' efforts to produce analytics to reduce healthcare costs. We have worked extensively during the COVID-19 pandemic to provide insights on transmission risk in different areas and environments, while also developing models to assess medical supply, such as ventilators and PPE, and the needs at different geospatial levels and medical facilities. All of these, so for those unfamiliar with zoonotic spillover, I'm going to go into some detail about what the term means, and I'll give you some context around the motivation for this model. Very simply, a zoonotic spillover event is when a pathogen moves from an animal reservoir to a host to a human population. This phenomenon happens consistently and frequently around the world, with humans being exposed to new pathogens from their interactions with animals around every year. Some examples of zoonotic diseases causing infections in human populations are Ebola, tuberculosis, HIV/AIDS, SARS-1, and most recently SARS-CoV-2. Typically, a zoonotic spillover event happens when a new pathogen travels from a reservoir host through a combination of secondary hosts and the environment until it eventually leads to a human exposure. As you can see from the Swiss cheese model, there is a certain probability at each of these different stages that a pathogen will survive and replicate until it eventually reaches and replicates in humans. What's important to understand is that not all zoonotic spillover events are created equal. Every year, there are hundreds of potential pathogens that humans are exposed to, and it's rare that this will lead to a global or even local outbreak. However, there is strong evidence to suggest that climate change and economic development, as well as other drivers, are increasing the likelihood of this happening. One of the main factors that leads to an increase in probability for an animal pathogen jumping to humans is simply more human-to-animal interaction. We know from previous research that human encroachment, whether it be from human or climate change-related forces, accounts for 30% of all zoonotic emergences. On top of that, we also know that rapid changes in ecosystems lead to loss of biodiversity. This usually leads to reduction in large-bodied species with longer life histories, mammals that you would typically think at the top of the food chain, but an increase in smaller-bodied, fast-life species, which are more likely to transmit zoonotic pathogens, things like rodents and small avian species. This loss in biodiversity comes as a result of deforestation and destruction of natural habitats, which are both caused by climate change and direct human involvement. As a result of these ecological changes and the increasing connectedness of humans, as well as humans and animals, it is expected that the rates of new global emerging infectious diseases are not going to slow down. This has dramatic political, economic, and health implications for the world. And because of this, we need to understand how to break the chain of transmission for both animals to humans, as well as humans to humans. So disease surveillance is not a new concept. There are dozens of interconnected systems that are deployed today. Throughout the past 2 decades, there have been many international initiatives to develop the technology and infrastructure required for the surveillance of infectious diseases. Many of these technologies come in the form of applications that are used for disease reporting and basic analysis that are scalable depending on the reporting capabilities of the user population. HSR.health is working to build off of these systems to develop additional applications that can provide a more holistic understanding of the risk of prediction of zoonotic spillover events using advanced machine learning and diverse data sets. This brings us to our approach. Based off the drivers that we have identified for zoonotic spillover, we have developed a concept for a machine learning model that calculates the risk of spillover in different geographical locations based off broad ecological factors, like the ones I've laid out, in addition to human mobility and climate change data. Data sources approximating those drivers will be paired with historical emerging infectious disease data to quantify the effect of different drivers and predict future spillover events. The plan is to then use the insights gained from this model to inform proactive response for public health decision makers and appropriate parties where outbreaks may be occurring. To go into a little bit more detail, we have the proposed model here in this diagram. The training data, or the units of observation for the model, will be historical data on grid cells representing land areas where there have been emerging infectious diseases. The features are the grid cells corresponding ecological, climate change, and other driver-related variables. And although the list of data sources for the model is growing, we plan to standardize the granularity of the training data to the highest granularity we have available. The training data will then be pre-processed and fed into a classification algorithm to determine the relative weights for each of the variables or features included in the model. These weights will then be used to create a choropleth map of the relative risk of spillover, which includes how the different drivers influence this prediction. You can see we have a created prototype of the choropleth map on the right of the diagram here, and this is using synthetic data, where the shade of red corresponds to the probability of an emerging infectious disease event. We can use this analysis to designate where early surveillance interventions could be used and where to allocate resources to respond adequately to new pandemic threats. In this slide, I want to highlight our data pipeline and how this all fits together with the disease intervention and surveillance solution that HSR has. We have already developed a robust infrastructure utilizing AWS and multi-cloud to update our current disease analytics. And this pipeline has been built to scale with the additional data sources and computational power required for training and deployment of this model. To conclude the presentation, we went over zoonotic spillover and how climate change will likely affect spillover events, as well as the role both of these play on human health. I also want to highlight that most surveillance systems currently in place are reactive rather than proactive. And in order to respond to pathogens quickly, we need to practice in how we prepare. This model is in development and we'll be able to make accurate predictions about where and when zoonotic spillover events may occur and when they are occurring. If you all have any questions, please let me know, and thank you for the opportunity to speak.
Thank you, Jay. And now our next two panelists I'll introduce together as they will make a single presentation or collaborate on their presentation. Anthony Arce is the Data Coordinator for San Bernardino County Department of Public Health's Community Vital Signs Population Health Initiative and Program. He has extensive experience with public health research, working in several local health jurisdictions and programs, and collaborating with different stakeholders and communities, especially in examining chronic disease, social determinants of health, and health equity. He specializes in building data collection processes as well as accessible and engaging visualizations, applications, and tools to aid with the department's health improvement initiatives and COVID-19 response. Anthony loves to run and has run marathons across different terrains. He's looking to get back to it as the response to the pandemic eases. And joining him on the presentation is Serene Ong, who is a GIS analyst for San Bernardino County's Department of Public Health. She performs spatial analysis and creates maps and applications to inform public health policy and response. She has more than 20 years of applied GIS experience in the fields of natural resources and conservation, economics, and public health. Serene and her husband share their home with 5 furry, adorable, and sometimes obnoxious cats and dogs. Welcome, Anthony and Serene.
All right. Well, thank you, AJ, and thanks for having us. And yeah, we're glad to be here and glad to speak on what San Bernardino County Public Health has done with GIS and provide that local perspective. So let me go ahead and share my screen. Okay. Yeah, so many of you may be wondering, where is San Bernardino County? So this is the United States, and we're in the state of California, and we're just east of Los Angeles. So our county is actually the largest county in the continental US. And because of that wide spread of geography, we contain a diverse region of valleys, mountains, and deserts, and diverse population and communities, and many of which may be geographically isolated, and that provides many unique challenges, especially in accessing care and our services. So ultimately, this diversity is our strength, but it's also our call to action as we try to just address the multiple needs and different kind of services that our constituents would require. So it's our call to action. So in kind of looking at health and looking at geographically where folks are placed, a thing that we like to look at is life expectancy, and notably understandably in our county, there's a widespread. In fact, we actually have one of our cities is a blue zone, and a blue zone is a specific area where folks tend to live longer than the normal, a lot of them living to 90 and even 100 plus. So yeah, that's in the city of Loma Linda right here. But if you just look just north of that, in our cities of San Bernardino and Colton, you can see a lower life expectancy, even 10 to 15 years less than their surrounding areas. So this is where we really want to look at equity and just like the importance of the social determinants of health and how different factors, not just purely health outcomes and just even health in general, affects people's well-being, but also looking at their access to economic opportunities, transportation, access to green spaces, and even environmental exposures. And this is where we like to look to the Healthy Places Index, or HPI. And this is a tool that was developed by the Southern California Public Health Alliance, again, to advance equity in the state. And then we also want to consider our different subpopulations in the county, looking at race, ethnicity. Notably, we have a population of over 50% Hispanic or Latino, and being able to think about language access, cultural humility, and just the systemic and historical factors that have provide barriers for them in accessing care in our services. So, ultimately, our mission in the county and in the department is to work in partnership to promote the health and wellness and safety and quality of life for San Bernardino County residents. And then in promoting that in our values, we want to collaborate, promote diversity, strive for equity, and the last two, innovation and transparency, is really important in building our infrastructure, our data infrastructure, and our geospatial planning. So yeah, with the wide county and such a diverse population and only so many staff and resources, we really have to be creative and innovative, like we mentioned before, in terms of addressing a lot of these needs and being able to effectively and timely respond to a lot of the ongoing issues and needs of our residents. So just up here is a quick gallery of some of our maps and applications that our programs have used to kind of assist in our workflows in the county. So this is going a bit deeper. This is just kind of a few case scenarios of how our programs have utilized geospatial technologies, especially working on the field, collecting data, and then being able to process that in near real time, and being able to provide timely assessments to our managers and just the public in general, just to see where we're doing the work and, if needed, where a lot of the attention should be brought to. And this is just a quick summary of some of those programs that I mentioned. And then, yeah, the thing that we want to call our attention to is specifically is our efforts in outreaching to the population experiencing homelessness. Historically, we kind of had them come to us for services, but we realized that there's a lot of barriers with that. And then we want to kind of rethink our approach and think about going to where they tend to congregate, or like where there's the most at risk. And this is what we did through our innovative remote on-site assistance and delivery program, otherwise known as Inroads. So we collected field surveys and used applications, and ultimately use point-in-time counts to identify hotspots of those areas and concerns. And then with that data, we were able to engage and work with that population and provide wraparound services. So not only health screenings, but also provide them food, make them help them be food secure, provide support for mental and behavioral health. If they have animals, providing animal care as well. And this was especially important during the pandemic, and especially even with hepatitis A outbreaks and other sexually transmitted diseases, being able to do that screening, testing, and also provide vaccinations to mitigate the risk of spread of disease. Ultimately, this was a huge success for our department and county. We were able to walk across our different programs, across different departments, and really increase that engagement with that hard to reach population. And ultimately, we were able to increase our service rates for that group. The other thing we'd like to call to is just our work with environmental health services, kind of notably just going through making sure everything is up to code. This includes food facilities, wastewater systems, water systems, pools and spas, just making sure that everything is safe for everyone to either engage in or consume, and as well as non-permitted kind of vending, and again, making sure that folks are safe when they either consume or engage with that in the public. And as well as that is also vector surveillance, kind of mitigating vector-borne diseases, notably mosquito control and West Nile and other arbovirus mitigation, and then pairing that with just public complaints and being able to see where there's like huge clusters of instances, or being able to reallocate resources or just place more traps so that we can effectively respond to the needs of the community. And lastly, as I mentioned, we work with a lot of food facilities, and there might be a lot of food waste, and we just want to bridge that gap with charitable feeding organizations. And ultimately, we don't want that food to go to waste, and be able to kind of give that to the folks in need and be able to have those resources, help out those in need. So yeah, that was just a quick overview of our initial applications of our geospatial technologies. But yeah, I'm gonna hand it over to my colleague Serene to talk about the road ahead.
Great, thank you very much, Anthony. So most of us in the research assessment and planning team were hired in mid-2019, so we're a pretty new and young team. When COVID-19 started, on top of the regular public health work we did, we of course also did a lot of COVID-19 response work. Most of it was ad hoc and on short and urgent timelines. We had to build workflows to quickly report regularly to our decision and policymakers, our stakeholders, and the public. Through this, we learned a lot from these experiences, and now we want to emphasize planning and prevention so that we're better prepared and can more effectively address challenges before they happen, or at least catch them in early stages. Some of our work that went beyond visualizations and field applications were where we looked at health equity and access to our services. For the Women, Infant, and Children program, the WIC program, we mapped the WIC clinics, and we also created a density map of where these program participants lived. We also looked at the distance they would have to walk to take public transportation, as most would likely not have access to private transportation. In addition, we looked at the distance between clinics, and all these factored into the decision of where the next clinic should be located. For our oral health and outreach and education program, we mapped out the safety net and government-supported oral health clinics and analyzed them against the lowest HPI quartile census tracts and demographic data. Next slide, Anthony. Yeah, thanks. We wanted to see how close these services were to the people needing such services the most. And that would be those with limited means and those who lived in areas of limited dental services. Similarly, for COVID-19 testing, we mapped COVID-19 testing sites and antigen test kit distributions against the lowest quartile HPI and average household size. We looked at household size because larger households have an increased risk of COVID transmission among household members. Usually these houses also have multiple generations living together and include people from age groups at higher risk of COVID, that is those 65 years and older, and children under 5 who have up till recently been unable to be vaccinated. A health equity analysis like this can help to identify where to distribute testing resources like testing events or home test kits to communities where transmission is highest or where populations may have barriers in accessing test centers or healthcare. For asthma intervention, our family health services program, we mapped the impact of asthma on children, the number of emergency room visits in a year by children, primarily for asthma. We then looked at this data in context with the US EPA air quality data and demographic data to see whose children were being impacted and where. So with the aim of anticipating and responding to issues early, here are some examples of work we currently engage in. We have partnered with Loma Linda University to set up wastewater surveillance with the goal of detecting COVID-19 in the wastewater. Wastewater epidemiology has been used to track infectious diseases, but this method can also be used to detect other things like environmental toxins and other substances. We're expanding our use of dashboards to track a wider range of infectious diseases, such as influenza-like illnesses, sexually transmitted diseases, as well as internally tracking our workload, performance, and resource needs for our case investigators. We also use syndromic surveillance, which allows us to stay in touch with the health of the community in real time. So this can be the tracking of the use of therapeutics and medication, emergency room visits, hospitalizations for a variety of reasons, like heat-related illnesses, different diseases, opioid overdoses, and other things. So on a different track, for environmental health services, we also prepare for and respond to wildfires and electrical outages. We map and track wildfires or electrical outages using real-time fire data from the State Fire Department, from MODIS satellites, and also from the local utility companies with our circuit data. We use their impact boundaries and the directions to contact food and water facilities that may be impacted. We also want to, in the future, use additional non-conventional data sources, such as data from social media, to help us anticipate and predict health risk situations. For example, data mining social media and regularly used apps like Yelp, Facebook, Instagram, Twitter, and others can support health interventions and inspections. Yelp, for example, provides dine-in and takeout designations by which we can check for restaurant compliance during a pandemic. We can also look to social media to find large gatherings and events where there might be exposure to infected persons or unsafe and unpermitted food and drink. We can also go to such places and address risky health behaviors with health education. Such data mining means expanding our automation processes, and we will need additional technologies for extracting and transforming such data into usable formats. So this is one area where AI can play a big role, big and useful role for us. Finally, to revisit our mission and values, we have plans for a geospatial strategy that aligns all our geospatial resources and efforts with the counties and departments' missions, values, and goals. We also look to invest our people and resources into new and innovative technologies so that we can have the best possible impact. So we've done much in terms of geospatial analysis, visualization, and work-enabling tools, but GeoAI is an area we have yet to venture into, and we're excited to learn how to use it to take us to the next step into improving the way we help our stakeholders. Finally, we'd just like to end here by thanking our county leaders, our colleagues within the department, and also across the county for their support of our work. We'd also like to thank Esri not only for their technical help, but also for being our champions. And finally, we thank all the organizers of this webinar and the webinar series for making this platform and these events for sharing our work, ideas, and for facilitating networking. We leave you with a couple of pictures of where we work and some of our Department of Public Health team. And here is our email if you would like to contact us with any questions or comments. I now hand you back to Ajay. Thank you very much.
Thank you, Serene, and thank you to all of the speakers. I welcome you all to turn on your cameras and we will respond to questions from the audience. I'll wait for everyone to turn themselves on and then we'll start with the first question. Yes, thank you all. First question, and Nadine actually is for you. How do you envision the role of GeoHealth or global health fitting into the OGC's upcoming initiatives?
So first of all, thank you, everybody. This was very diverse and very informative. I really appreciate it. As a non-health person, I learn every time we have one of these, I think, sessions. As a geo person, right? That it's just fascinating. So very appreciative of Ajay's effort putting the panel together and every panelist. Thank you. How does this fit? I think COVID showed us how it fits. Actually, it showed us how it doesn't fit and how the opportunity for it to fit is really, really now. So I think what we've experienced in COVID was a lot of health resources and non-health resources that could be brought in together so that we can accelerate the decision making. And we had, one example after the next. And what we found is that connecting those systems so that we can, start to do the GeoAI or any AI has been difficult. And I think that's where Geo, first of all, was a great connector, because where you live impacts your health, and the pollution around you impacts your decisions that you make as an individual. And then you've got the role of the government and the social equity that was just mentioned, I think, in a couple of presentations. So you have the personal, I think, how it impacts you, and then the government. And the geo part becomes, it's the way we see how these connections are made. And to assume that we can do this via spreadsheets is not 2022. It's not at all where we are today. We know that geospatial can help us determine or figure out the patterns to link data in ways that can help us really, really zoom in and hone our decisions, I think, again, personally and policy-wise. And then you add the AI and the analytics that we're doing here. I go back to Lukandra's presentation in the kickoff of the series about what exactly is GeoAI, right? So how we're doing the patterns based on things being near each other and happening near each other and overlaying on top of each other. And you see a totally different picture. We are doing in OGC, the health domain working group, for example, is as energized as ever because they're seeing this opportunity. And honestly, the gaps, we have a lot of gaps to fill. And then this concept of national or international global health spatial data infrastructure so that we can set things up in a way that they are interoperable from the get-go so that all of our speakers can, focus on what they do best. And we provide so many opportunities for businesses like HSR.health to actually shine. And again, I go back, I use it again and again, accelerate, right? Getting decisions and good data, actionable information to our policymakers. Does that sort of answer the question?
Yes, I think it does. Thank you, Nadine. This next question is for Steve, for Serene and Anthony, but Steve, I might like your thoughts on this as well. But the question is for San Bernardino County, which of the solutions that you've talked about at a local county level do you think might translate to a global context?
Wow, that's a really good, tough question. I think a lot of these things that we do can translate to a global context. Certainly looking at demographic data and looking at perhaps an index where you combine all these health risk factors, and where such phenomena are happening, can be applied everywhere in the world. So I think that's one thing I would reply. Anthony, any additional thoughts?
Yeah, I was going to say, I think a lot of these issues or the folks our residents are experiencing, I think that can be applied to different parts of the world, notably just the state of the economy and like having folks like where they have to decide, do I choose housing? Do I choose eating healthy? Do I choose, supporting my family and my kids? So like making those hard decisions, especially when you don't have a lot of resources, and then that really impacts your health, and making sure that we can mitigate that by either support services or just addressing the broader issues.
Steve, would you like to comment on that? From a global perspective, yourself operating at the WHO, how do you see the partnership with the local community?
I think we can do a lot. I mean, in two respects. One is what we want to do is, if you take health information systems, what we want to do is help local communities, local health facilities to use the health, to organize their health information systems so that they can use the information. And where the geospatial component comes in is, disease and emergencies doesn't always respect national boundaries or administrative boundaries. So the fact, if there's an emergency in one place and just across the border, there's a health facility that can provide access, having that information where the health facility is, but also the capacity of that health facility, that's really, really crucial. But I think also what we can do is use these types of tools to help countries in their capacity. So if you take, for example, we build a global composite index for health, universal health coverage. And because it's a global index, there's all sorts of compromises made in the construction of that index so that we get global comparability. And sometimes those compromises in the index selection and the indicator selection, they undermine the value if you want to use that information at a local policy level. So what we're interested in doing is building a better universal health coverage index at the global level, but then providing all the code to the countries, to the local areas, and saying, well, okay, now you can reconstruct that index at national level or at regional level, but you use different weights, different indices, but the methodology is the same. And then that index is actually more applicable to you from a policy perspective at the local level. But you just have to understand then that the index value for your region or country will be different to the one that WHO is using for international comparability. So I think there's a lot of stuff you can do like that that really, really makes it useful.
Can I add something here? Just to reply to Steve, I think that's a great idea because it's something we've been thinking of as well. The California Healthy Places Index is for the whole state of California, but we also want to look at what's unique to San Bernardino County and what specifically impacts our populations. So taking that and customizing it, tweaking it to make it really applicable to our local situations is an important thing.
Yes, I like to think of that as language translation, right? So even when, like in the state of California or a particular nation with a national language, there are always dialects in local areas that are just simply different. And sometimes the words and word tense and meaning of certain things are different. So any kind of message at a national level needs to be translated to an extent at local communities. Our public health models are no different, right? They need to be weights perhaps change or other changes in the public health model from global to national to local levels. And we have another question coming in for you, Steve. Does the WHO currently have a geospatial solution for addressing the monkeypox outbreak?
I don't know is the short answer, but certainly we're using GIS to look at it. So like one of the first things we do now with outbreaks is we start mapping where the outbreaks are to see, can we spot patterns? And then that feeds in then to the solution. So at the moment, I know Ravi, the head of the GIS Center, is actually on mission to do with this. That's the first step. But what the solution arrives, that's outside of my area then. Like our job is to provide the information. But certainly GIS feeds into the analysis of the problem, if I can put it that way.
Thanks, absolutely. I think we have time for one additional question. The last question, actually, Jay, is for you. What other solutions does HSR have for disease monitoring?
Yeah, so it would be hard to list all of them in a short amount of time, but we have worked a lot during the COVID-19 pandemic on analytics around, like I said in the presentation, medical supplies routing and PPE needs, and also vaccine needs. As the pandemic has kind of gone on, we've also focused on vaccine hesitancy and vaccine needs. So how to target certain populations that are hesitant for different reasons. And we've also developed analytics to predict and understand COVID-19 transmission in indoor spaces, as well as on a more broad level using agent-based modeling. So we have many different solutions around COVID-19 and also many new solutions that are around health equity. So, yeah.
Thank you. And with that, I'd like to thank all of the speakers one more time for an excellent presentations and discussion. And I hope that the audience and all of the speakers will join in the networking area on the neural network for another 20-30 minutes. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you very much, Ajay. I thank you very much, Nadine, Stephen, Jay, Anthony, and Serene for having contributed to this session, and thank the audience for your participation. I found the session very, very interesting with so many applications of geospatial data for health, and learned how a combination of different kinds of geospatial data sets and machine learning can really provide new insights in the health sector. Before ending, let me remind you of future GeoAI events. We will have tomorrow the GeoAI Challenge launch event, and on July 12th, we will have a deep Earth query, information discovery from Big Earth observation data archives. I want also to remind you that the recordings of all events are available in YouTube and on the neural network to which you are connected right now. I thank you all again for your participation. And with this, let me give back the floor to Anna, and I'll see you in the neural network. Thank you very much.
Thank you, Ajay.
Thanks.
Thank you for participating in today's AI for Good session. We hope you've learned something new, innovative, and engaging in today's event. We now encourage you to continue the conversation on the live video wall in the neural network. Here you can ask questions, like and comment, share links, complete the satisfaction survey, connect with interesting profiles, or speak one-on-one using the chat and video function. After the 30-minute networking session, we invite you to explore the lobby, try the smart matching quiz, visit the virtual exhibits and poster boards, and build your personalized AI for Good program. It was a pleasure learning with you today. See you at the next AI for Good.